Hey guys, Dr. Brotsky here. It's week 26 of your pregnancy. So at week 26, you're so close. You're almost in the third trimester. So you're almost ready to switch over to those every 2-week visits. So this is becoming definitely more exciting. So your baby's actually practicing breathing at this point. And that's very reassuring because that diaphragm is becoming more and more strong, and you can definitely see this on the ultrasound as well. We even use this to assess a baby's well-being later on in pregnancy. So this is a good point of development to take note of. Things you might start noticing around this time: obviously your belly's getting heavier. You may have some lower abdominal cramping, especially if your bladder's full or something like that, or if the baby moves in the wrong direction or location. It might shoot pain here and there. If it's quick and it's short-lived, it's usually very benign and nothing to worry about, but definitely talk about that with your doctor. You may notice that you're getting even more swollen in your feet and your hands, and you may get more lightheaded or dizzy when you stand up for a long period of time. So give yourself a break, pay attention to those symptoms. The last thing we want is for you to pass out. So if you're feeling a little bit dizzy, make sure you're taking time to sit down, elevate your feet, and drink plenty of water. From a doctor's perspective, around 26 weeks, we are hopefully in the process of doing your glucose testing, as I've mentioned before. You can also start to pre-register at the hospital, especially if you've already done your classes or a tour. You may already know where you want to have your baby at. So when you get close to the third trimester, that's a good time to just plug your insurance information into the hospital system so that you're already there when you get there to have your baby. And then I mentioned before that some patients who have an elevated 1-hour test for their diabetes screening may go on to do a 3-hour test. So if that happens, a 3-hour test is the diagnostic way to determine if you have gestational diabetes or not. So just listen to your doctor and go by their recommendations. Things that you need to do right now are possibly start making some lists of questions for your doctors about your delivery. This is the time when you can start discussing some of those details. Also, going to those prenatal classes at the hospital or elsewhere might actually stimulate some questions to go over. My patients always have more questions when they go to the class and come back after at the next visit. So just keep an eye on that and make sure you're making a list, because again, you'll forget it if you don't. That's it for week 26. Thank you so much for checking out the video. Check out my other videos on the same channel and watch drbrotsky.com.